Good morning. Thank you for considering our medical facility. My name is Madison, and we are choosing the bus for our presentation today as we believe that it is the best option, as it is by far the most mobile option out of the three. It has more space than the supply containers while being able to go on more roads and be much more mobile. When stabilizing the previous patient, we had to assess the scene, take her to the ambulance, administer medicine, and stop the bleeding. But the bus will be equipped to do all of that and more for several patients. Mock scenario. A building under construction collapsed in a major urban area during rush hour. Patient number 1 is a 42-year-old male whose car accident has a severe headache, stiff neck, and nausea. Patient number 2 is a 17-year-old male with a sore arm after colliding with a woman on a bicycle. He is having trouble moving it, but has no cuts or broken bones are seen with the naked eye. Patient number 3 is a 28-year-old female hit in the head by debris. She is unconscious but is breathing and has a bleeding wound in the back of her head. Patient number 4 is a 37-year-old female having difficulty breathing and her eyes are watering as a result of exposure to dust from the collision. Patient number 1 is urgent. Patient number 2 is also urgent. Patient number 3 is emergent, and patient number 4 is semi-urgent. Patient number 1 needs a neurological check and stabilized neck to be put in the vital monitoring machine and sent to hospital for more imaging. Patient number 2 needs the arm checks for swelling, movement, circulation, and X-ray. Give patient pain relief medicine and swelling until X-ray comes back. If the injury is severe, send it to the hospital. Patient number 3. Immediately, the first priority is to use the breathing machine on the patient, secure the airway, control head bleeding, and send to hospital for more advanced treatment. Patient number 4. Give them an oxygen mask, rinse eyes with saline, and check vitals and also lungs.
Okay, so out of our 4 staff members, 1 is a nurse practitioner, an advanced practice registered nurse with specialized graduate training who offers a variety of medical services such as medicine, prescription, disease diagnosis, treatment, and management. Our nurse will be able to prescribe and administer the various medications we have on our bus. The second is a paramedic, a highly skilled medical practitioner who works in emergency medical services and gives patients life support and advanced medical treatment either before or during hospital transportation. A paramedic would specialize in prepping the needed patients to the hospital. The surgeon who specializes in treating injuries, illnesses, and deformities by replacing, removing, repairing damaged tissues or organs, surgical instruments, and methods of surgery necessary to treat many different patients. Phlebotomist, a medical practitioner with expertise in medical devices around the bus and are able to use them in an emergency situation. The phlebotomist also preparation of driving the bus when the other staff members are busy. Every bit of information about the patient that we know will be an asset when contacting the main hospital. So the medical devices we're going to have on the bus, one is an X-ray / ultrasound used for diagnosing and providing images of internal body structure, injuries and abnormalities all throughout the body. Crash cart is used to install IVs and it contains emergency medications that has an automatic external defibrillator used to help with severe cardiac issues. Monitoring system will be used to monitor vitals in real time, alarm the staff if something is awry, and send the data gathered to the hospital. The breathing equipment will be used to give the patient oxygen, support the breathing, and has intubation to assist in those necessary situations. Our refrigerator can be used to store medicine, possible samples, and any other item that might be temperature sensitive. So we have 10 medications. The first one is epinephrine, which treats anaphylaxis, stored in cabinets, and it's an EpiPen injected into the middle upper thigh. Ibuprofen treats mild pain, fever, and inflammation, and is stored in cabinets. Morphine treats severe pain and needs to be locked away. Same with anesthesia; it's used in sedation. Narcan is used for drug overdoses, and it's also stored in cabinets. AV saline, it can be used for dehydration and electrolyte rebalance. Needs to be stored in either a refrigerator or a cool area. Albuterol is used for asthma and bronchospasm. Also needs to be in cabinets. Diazepam is used for anxiety attacks, seizures, and muscle spasms, and would be good to use in the refrigerator. Insulin also in the refrigerator. It treats diabetes and helps with blood sugar regulation. Antiemetics are medications used to inhibit nausea and vomiting. They need to be stored in a cabinet. We have a lot of basic supplies that would be stored in supply closets, such as tourniquets, personal protective equipment, syringes, bandages, cotton gloves, forceps, IV equipment, biohazard bags, stitches, stethoscopes, flashlights, scissors, crutches, slings, casts, ice packs, anesthesia masks, sterilization equipment, and stretches. On our diagram, as you can see, attached to the assignment is 4 beds which are arranged in bunks on top of each other, 1, 2, and 1, 2. An operating area with an operating table, an intake zone, a bathroom, a disposal zone, a refrigerator, several supply closets, a ladder, seats next to the entrance, a crash cart, an X-ray machine, a sink, and a small table.
Facility capacity estimate. Considering that the mobile facility possesses 4 beds, 4 employees, 1 field top nurse, 1 paramedic, 1 surgeon, 1 nurse practitioner. Before the patients are sent out, the facility is intended to stabilize them and provide immediate care. In patient intake, this is the initial phase in which each patient is evaluated to ascertain the extent of their injury. Arrow 1. In the target area, patients are urgent. And those who are urgent will be evaluated first. Arrow 2. Basic care and oxygen will be administered in semi-urgent cases like patient 4, while their vitals are tracked. Area of assessment. Patient 1 will be put in the bed for vital monitor, neck stabilization, and neurological examination. Patient 2 will receive pain management, be put in a sling, and have their arm examined for injuries and potential fractures. Patient 3, for bleeding and controlled airway managed, they will be sent for critical care unit. Patient 4 will be put in area to rinse their eyes and receive oxygen treatment. Patient 1, 3, and 4, the paramedic will be sure that they are stabilized before departing the mobile until it orders to get them ready for transportation to the closest hospital. This could entail providing oxygen support, pain management, IV fluids, or airway security. Transportation depending on the extent of the patient injuries. The mobile unit staff will prioritize transportation them to the closest hospital when they have stabilized. The nurse practitioner may go to these patients to supervise their case while the paramedics make sure they are transported safely. Nurse practitioner. The duties of the nurse practitioner includes patient assessment, diagnosis, medicine prescription, and non-critical injuries management, and overall patient care supervision. Stabilize the patient's neck, do a neurological examination, and treat any acute symptoms. In patient 1, the process of sending this patient to the hospital for advanced imaging and will be managed by the nurse practitioner. Patient 2, examine the fractures, treat pain, and supervise the use of a sling for this 17-year-old male patient with a painful arm. Order an X-ray if necessary, and the site of the patient has to be admitted to the hospital. Now, patient 4, give her oxygen and keep an eye on her respiratory condition. The nurse practitioner will determine whether the patient needs additional hospital treatment if the condition worsens. Now, the paramedic, patient will help stabilize the patient's neck and administrate any necessary care right away. While getting the patient ready to be taken to the hospital, patient 3, the paramedic will give priority to this patient, a 28-year-old woman who has suffered a head injury, in addition managing breathing support and halting any ongoing bleeding. The paramedic will make sure to be the patient is stable enough to send the hospital. If necessary, the paramedic will help the CPR or other life-saving technique. Patient 4, if the patient condition worsens, make sure they are stable enough to be transported. After administering oxygen and keeping the eye on the patient, get them ready for the hospital transportation if necessary. In general, the paramedic will help prepare patients, especially if there are more critical ones on evacuation. evacuation. And now the surgeon. Patient 3. The surgeon will help manage the head injury, secure the airway, and control any bleeding in the 28-year-old female patient. Since the mobile unit track lacks the complete surgical capacity to treat head trauma, the surgeon will stabilize the patient for transport to the injury cause for surgery. Patient 1. The majority of the care will take place after the patient is reported to the hospital, but the surgeon will treat any additional injuries that need surgical evaluation or intervention right away. Patient 2. The surgeon will help with any trauma associated with the arm injury, but may not require unless there is more complicated fracture or internal injury. Now, phlebotomist. Assist patient 1, 2, and 3 with managing medical equipment and heartbeat monitors and oxygen tanks, etc. Keeping an eye on vital indicators and helping to set up IV if needed. Be helping on this helping by basic care that can be provided during trike, or the firefighters will also aid other staff members. Driving the bus. The firefighters will operate the bus, guarantee proper transportation in the mobile facility. You need to take a patient to the hospital, or if the staff member are occupied with patients. Helping with blood draw. The firefighters will help with the blood drawn for any necessary lab or testing. But the nurse practitioner is probably the one who will recommend the lab test or diagnostics.
We needed different people to do the different necessities throughout the bus, such as helping patients, diagnosing, driving, and using the supplies well. We picked one person who would be good in a trauma situation, one with medical expertise to maximize the limited supplies we had, one person who's a general surgeon to help with whatever issue might come across, and one person who is well equipped to deal with patients and their families, and one person who knows how ambulances function in cases where patients need to be transported to the hospital. I believe that the layout of our refrigerator was extremely innovative, as it shaped extremely uniquely and in a way that maximized both our storage and capacity and ease of access for the staff. Thank you for your time, and we hope you consider investing in a new mobile medical device.